So today we are going to be going over feedings and medication administration. There was 4 things left that we needed to check off on. The others we've already done in Skill Lab. So it was the G&J tube, the Lopez valve, the residual check, and medication administration. So the first thing we're going to do is check the patient's chart and gather the supplies that we need, because everybody's chart's a little bit different as far as what they're using for flushings, and how much to flush with in between, and make sure that you have a waterproof barrier, your TUMI syringe, whatever you may need for flushing, your gloves, and your Lopez valve. And so I'm first going to start off by going in and prepping the patient, making sure they're in the correct position, if possible, depending on the patient. And then I would also prep everything. I would want to wash my hands and put on my gloves first off. I would want to tell the patient what we're going to be doing, and even if they can't communicate with you. And then I would want to check for placement first off. So checking for placement, I would use 15 ml of air. So I draw back with my TUMI syringe, and depending on if they had a feeding on or not, I would shut that off. So say the feeding was on this way, I would want to hook my TUMI syringe up here first, and then I would want to turn this so the off position was this way, so nothing was flowing backwards. And then once that was hooked up, I would have my stethoscope and place it correctly, depending on if I was using a G tube or J tube. But if it was a J tube, I would not want to do it if it was a far J tube. So I have it hooked up as so, and have the off going in this direction where the feeding was, and I would instill it, and at the same time I would have this in, and I would be listening for a whooshing sound to check placement. Another thing I can do, if it was a G tube, I could pull back and I could check the pH of it as well, and then you would not want to do that on a J tube though. And then you could also want to do the residual as well to check. So say if they had just had a feeding done and you have your graduated cylinder and you're checking your residual, again, the feeding would be off, and then you would have a TUMI syringe, your graduated cylinder, and you'd have this attached, and you would want to pull back and keep putting it in while measuring. But if there was anything over 150 ml, you would want to contact the doctor and let them know. And you would definitely want to know like when the last time they had their feeding was, and how much was administered in that time frame as well. So the next thing we are going to be doing, I believe here, would be the meds. Now the medication, the same way. If there was a feeding and before instilling anything into any of the tubes, you want to check placement no matter what. So again, go over those steps to check placement, and then once that was done, you would want to clear the line prior to with a medication. So again, depending on the patient's chart, we would take the TUMI syringe out, hook it up to the Lopez valve, shut this off. If I could, depending on if there was no feeding, I would want to hook this up to the, say if it could be hooked up like this, I would want that rather than coming from the side. That way it's more direct. So therefore, I would want to fill this up with the prescribed amount of water or sodium chloride, whatever the doctor prescribed, and then let it flow so it clears out the line. And the next thing I would want to do, of course, was I would already have my medication gathered. I would want to make sure that they were compatible and there was not going to be any drug interactions with those. I would also want to check the patient's chart and know whether or not that I can give all these medications together, or if I need to do them all separately. If they needed to be done separately, I would again have to have physician's orders if it's together, but if they were separate, I would have to give each med separately and then flush in between each one of those, and then I would want to flush before and after as well. And then I would want to make sure that the whatever medication I'm giving, if it's not liquid, that it can be crushed, because there's some medications that should not be crushed and administered to the patient. Again, it's using 20 to 30 ml, just depending again on the patient's orders, because that's always different. It's not always correct. And you would want your patient to sit upright for 30 minutes after, if able to. And I believe that is all.